Alright, today I felt I should bring to our public lecture one of the common warnings I give to my that delay can be dangerous, and I want to expatiate more on that. Delay can be dangerous because of two particular characteristics of arthritis. It is progressive, it is destructive. It is progressive in the sense that it gets worse with time. It is destructive because it continuously destroys the structures of the joint. Last time we talked about the chemical events that go on in the joint, and we mentioned interleukin 1. Okay, so the more the arthritis continues, the more this chemical and other inflammatory chemicals build up in the joint. And what happens is that they encourage the formation of matrix metalloproteinases. These are enzymes or chemicals build up an inflamed joint that contribute to the destruction of the joint cartilage and ligaments. So arthritis is actually, in the age you have inflammation as the disease, but as time goes on, especially from 3 months upwards, degeneration becomes the predominant disease, each one encouraging each other. So when we take medications, especially at the early stages of arthritis, yes, they work. What do? They suppress the interleukin 1 and the inflammatory agents. They can clear them sometimes, but because of the destruction that has already started, these interleukin 1s and the inflammatory agents will still build up, causing the pain. So the vicious cycle will continue. Therefore, what is very, very important in arthritis is the destruction of the joint tissues, the cartilages and the ligaments. If that has started, arthritis is established. And if it is there, it is the destruction of the joint ligaments and cartilages that should be the focus of the treatment, and not the inflammatory agents. And that's where we get it wrong most times. So this is how, using the knee as an example, this is how the joint looks like. The cartilages that were supposed to be very smooth and thick will progressively be destroyed, exposing the surfaces of the bone. So when this person stands up, the bones rub on each other, and if it's not arrested, it leads to the deformity of the joint. It can be in the elbow, it can be in the wrist, it can be in the finger. For example, in this knee, the knee becomes deformed because the anatomical structure of the joint have been destroyed. The elements of the joint that keep the joint steady and strong have been destroyed. So not only in the knee, it can also happen in the spine, like in the neck or in the low back. Yeah, we have this disc which serves as shock absorber. The bones of the spine come in pieces, separated by these discs. So with these degenerations, you find out that the thickness of the disc will begin to go down gradually. The disc will begin to tear, and when they tear, the inner part of the disc will push out, compressing the nerves. Compressing the nerve and begin to irritate the nerve, causing pain to travel wherever the nerve goes. So the spaces through which this nerve passes can be compressed. So when this compression happens, the pain can happen around where this thing is occurring, or where the nerve traveled to. So some of us can go for X-ray, and here you have lumbar spondylosis. Lumbar spondylosis is part of this degenerative disease we are talking about, leading to the compression of the nerve. And when this happens, the whole leg, it can be in one leg or both legs, will be having pain. It can start going down to the buttock, from there to the back of the thigh, to the entire leg. Some will complain of needle and pin in their foot. Some will complain as if to say they're walking on sand. So these are due to compression on the nerves. And now, when we are talking about the appropriate treatment, just as most of you that have been joining us in this lecture will understand, we are talking about the natural treatment that is called regenerative therapy. That treatment has the capacity to repair and heal the worn out or the destroyed ligaments and cartilages of the joint. So the demonstration I'm looking at here is PRP, platelet-rich plasma, in which the platelet cell is harvested from your own blood, processed, and injected where the problem is. So when it's injected at the affected joint, it will gradually heal the ligaments and the cartilage that have been destroyed. There's no other treatment that can do that apart from treatment known as regenerative therapy. Because the growth factors in the platelet cells are the champions that do the work. That's the function of platelet cell. They heal our tissues. So when you get it in a high concentration and inject in the affected joint, it will release these growth factors, which will travel to where the damage is. They are attracted by a mechanism that's called chemotaxis. And when they get there, they bind to those damaged tissues and repair them. So arthritis can be repaired not by surgery, but medically, by PRP. There's also another regenerative therapy that's called prolozone. Cold laser also does that work. But when they are all combined, your joint can be restored back to a healthy joint. So it's possible for one to take his or her life back from pain. Instead of living every day in pains, one can live every day doing what you like doing most. Thank you very much.